They're basing that on evaluation of samples that were taken back in November, December, January of 2019, early 2020. And what they found were a couple of examples where COVID-19 antibodies were found in the blood. So it suggests that prior to the first documented case in the US, which I believe was in late January, early February, that in fact the virus could have been in the US prior to that. That said, there was no information about the travel history of the people who tested, whose blood samples tested positive. So it remains to be seen whether they had traveled from, say, Wuhan, China, or had not traveled at all, which would be suggestive that there might have been some community spread. So there's still some additional information that needs to be found. But this is consistent also with reports that we've seen from Europe and even other reports from the US that suggest an earlier circulation of this virus prior to the initial identified one at the end of January. The fact that it's become an opinion piece, that it's now been swept up into politics, it's no longer sort of a public health question. We need to know the origins of this virus so that we can be better prepared to prevent the next pandemic. I would hope that the United States could join with China and other countries to really put forward a global strategy that we all work together on to make these vaccines available to everyone. China is producing some excellent vaccines. There are excellent vaccines being made elsewhere in the world. How do we get these into the arms of the people where they have less access to these life-saving interventions?